Alright, we're going to look at antiparasitics, moving on to chapter 12. So looking at parasites and RVTs, RVTs of course are the primary client educator. Parasites are a public health risk. We know now that there's a ton of zoonotic parasites and in general diseases that can be spread by parasites that are a zoonotic risk. There are vectors, or they are vectors for disease. We talked about this a little bit already with ticks and Lyme disease. And then, of course, we always have to worry about our immune compromised owners. So owners who don't have as great of an immune system as the rest of our clients. A lot of times too, we get into trouble when owners use the products inappropriately. And then, of course, too, owners continuously get a lot of misinformation. So they get really intense, aggressive, direct marketing. And I'm sure you guys see it when you're on your computer around the start of the summer. You get a crazy amount of ads for tick and flea medication, heartworm medication. And then, of course, there's drug fear as well that goes into it. So, of course, our role as RVTs is to educate, 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 educate. And if you just have a look at these pictures here, of course, we have RVT cuddling the cat on the bottom. That's our ultimate fun day. However, when products are used inappropriately, or when some products are used for patients and perhaps it wasn't the right patient or that patient was particularly sensitive, then we can get into some drug problems and create skin ulcers or major drug reactions. So we need to know a lot about these products that are out there. So of course, challenges are keeping up with new products on the market. There are new products for us in the vet clinic yearly, and they're often similar ingredients. They're often similar mechanisms of action. And it's kind of like the drug companies are always trying to outdo one another. So one product will be released in, 2018. Next year, 2019, it's the same product with a small added feature. So we actually have to know all about it. And we have to know the ins and the outs of the new products. So the RVT keys are to become familiar with both the generic and the trade names. So we get to know a whole bunch of the different drugs that we're going to talk about with antiparasitic products. But you have to know which products contain those drugs in order to understand which part of the product is having which effect on the animal. It's this big, huge area. And then recognize older names of newer drug formulations because they change so often. Recognize drugs within a drug family, such as Ivermectin, Selamectin, etc. So if we just look at this small list of products, we've got HeartGuard, which is ivermectin and Pyrantel. We've got Interceptor, which is milbemycin. We've got Safeguard, which is fenbendazole. And it goes on and on. Sentinel, Advantage Multi, of course we have Advantage, we have Advantix, we have Trifexis, we have NexGuard. It's wild. So we have a ton of products that are always out there, new ones emerging each and every year. And with that in mind, in the States more so than in Canada, they get a lot of marketing for these products. They get a ton of marketing, and they get a ton of marketing for over-the-counter type flea, tick, heartworm products as well, which can be really scary. So when a client or a consumer gets marketing, heavy marketing, typically from social media, maybe from magazines, depending on where they live, they could get marketed a certain product that may not be the best product for their pet and for their needs. So why we have to counter market in our clinics, we always, we don't like selling products. That's not our forte, is to sell clients products. But when it comes to tick and heartworm and flea season, you'll notice in vet clinics in Ontario, we have a ton of marketing information. The goal for us is to counter market the products that we know are the right products for the client. We have to counter market to ensure that our products, ideally, get to the clients, because the products that we sell at the vet clinic, they are the ones that have been clinically trialed We have a high margin of safety generally. We know the dosages, we know the safety precautions, we know the contraindications. So there's a lot of reasons that we have to countermarket. If we think about some hypothetical type situations, of course, a lot of these worms, these parasites, we have to consider the potential for zoonotic diseases. And then, of course, our concern for zoonosis is always increased when we have individuals, clients, who are immunocompromised. Maybe if they're getting their product at the pet store, or if they're ordering it online, or maybe it was advertised to them through social media, maybe they think what they're treating their pet with is totally sufficient, and it's going to get all the parasites, it's going to get all the zoonotic concerns out of the system, and they're good. So unfortunately, that could be a huge misconception because they've been marketed toward to feel that way. An RVT, on the other hand, would be able to identify this gap in parasite protection and advise the animal owner otherwise. So if they think that they've got this broad spectrum parasite control, but you know that that parasite control only will cover roundworms or fleas or ticks and not everything, then you can have that conversation with the owner. But of course, if we don't get the opportunity to talk to the owner, then the veterinary professional's advice will be unheard. So looking at pest management, so looking at, of course, fleas, ticks, ectoparasites, it gets a little bit tricky, becomes a little bit of a gray area, because Health Canada, through the Pest Control Products Act, has some regulation in regard to some of these topical products that are being sold. So most antiparasitics that remain topical are considered pesticides, and this results in many of them being sold over the counter. Not as much in Canada as in the US, but for Canada, most definitely, a lot of the products, Advantage was a big one that got released into the sort of pesticide type category and is now widely available over the counter. That's a good, safe example, but there's other ones that are less safe that are available over the counter, such as Zodiac and Target for fleas and ticks. And if given to the wrong patient, they can have huge implications. Which organism are we most often trying to kill with topical agents? Well, that of course is this little guy, the good old flea. And now, especially in Canada, we are starting to see a huge influence in ticks, or a huge increase in the population of ticks. So starting to get into some antiparasitic compounds, we have to think about the principles of an ideal parasiticide. So this is straight from the textbook, but selective toxicity to the target parasite with safety for the host. It's an economical product, so the client can actually afford it. It's effective at all parasitic development stages with a single dose. It's safe for very old, very young, pregnant, or debilitated animals, and it does not produce resistance in the target parasite. Of course, any product prescribed by a veterinarian should be highly effective to ensure all are demolished. So looking at these features are all considered when new products are being created. And what you'll find is the effective at all parasitic development stages with a single dose. That is like the gold standard. So any product that originally comes out on the market, over time you'll start to see them reinvent themselves and make it more of an all-in-one type treatment, and ideally in one particular dose. So of course the challenge with acquiring those nice standards of an ideal antiparasitic is every single animal is different. Every patient is unique. So when we look at that use in very young or old, overly stressed, pregnant, or debilitated animals, some species of animals are overly sensitive to certain antiparasitics. And of course, we'll talk about that in regard to this little guy here, the white feet don't treat. Not all animals are going to react the same. So we have to remember that, there's no one silver bullet. We talked about that at the very start of our class. So again, every animal is slightly different. Does that Chihuahua not look like it's going to bite somebody? Look, he's got his little paw raised and everything. Sneaky Chihuahua. So what do we need to know? It's important to understand the parasite life cycles. So what are we treating? Why does a certain drug work? How does it work? Why might we need second or third dosing? And of course, where the parasite is living within the body. It's important to understand the drug, know on what, when, and where the antiparasitic acts, antiparasitic treatment failure, misunderstanding about limitations of meds against stages of parasite life cycle, misunderstanding about parasite life cycle itself. It's important to follow the directions and, of course, educate clients appropriately, and drug labels will always be your friend. So there's always reasons that the drugs fail. There's always reasons that the drugs fail. But knowing these reasons, hopefully we can help to mitigate these failures by working through these. So again, familiarizing ourselves with the parasite life cycle and which drugs affect which stages when appropriate. And then of course, always double check the label of the box, right? If you're not sure, just double check. Find out what it's effective against. Craziest part of our jobs, as always, we have to educate them about drugs we don't even sell. So just like we talked about with the gastrointestinal medication, drugs like Pepto-Bismol and kaolin pectate, which we don't necessarily ever recommend, we still have to know all about them because clients are going to be using them. So even though we don't recommend Zodiac, we don't recommend Target, we still have to know about those sort of pesticides that are sold at pet stores because clients are going to be buying them and they have adverse effects, and we need to know all about that, why it's happening, and how to treat them. Again, this goes back to the difference between an RVT versus somebody who is simply trained on the basic information. You guys have that additional knowledge. So looking at some terminology, we have insecticide. Insecticide is a unique little word. It refers to a drug that kills both endoparasites and ectoparasites. It includes most of the currently marketed antiparasitic drugs. Anthelmintic is a general internal parasiticide. And within that class, we have an antinematodal, which of course is roundworms, anticestodal, it works against tapeworms, antitrematodal works against flukes, and then antiprotozoal works against protozoa. Vermicide is a worm killer, and vermifuge is a worm paralyzer. And we'll talk a little bit about the drugs that actually kill the worms and the drugs that paralyze them. So looking at our different classes of antiparasitics, we've got antinematodals, anticestodals, antiprotozoals, heartworm disease treatment, heartworm preventions, and then external parasites or external antiparasitics. So this is kind of the order about what we will talk about in these sessions. Today, we're going to focus on antinematodals and anticestodals. So antinematodals, we're talking about nematodes, we're talking about roundworms. And the ones that we'll discuss are macrolides, different from the antibiotic macrolide that we had talked about, benzimidazoles, pyrantel, piperazine, and imodepside. Let's review those roundworm life cycles. So of course, looking at a freshly laid egg, so if we were to start it right here, let's just start there. I mean, which came first, the chicken or the egg? Who knows? Freshly laid roundworm egg passes in the feces from the infected host. After a month, the larva is ready to infect a new host. A dog is infected from licking up a worm egg during grooming, and then of course, it starts the cycle within the dog's body. Alternately, that larva, the wildlife, becomes infected from the contact with the soil. The dog is infected from eating the flesh of infected wildlife. And of course, again, that little roundworm takes up room in its gut and creates its own life cycle again. And then the other process is, of course, that puppies are infected from nursing on the infected mother. So again, all of these are going to factor into a continuous life cycle within the animal. Looking at the cat, so Toxocara cati, cat ingests Toxocara larva or the egg. The infected cat passes the Toxocara egg in the feces or milk Toxicare egg is passed in cat feces. Toxicare larva develops in the environment. And then, of course, the squirrel can get it. And then, once again, back to kitty. And likewise, essentially, with the Toxoscaris leonina. So it's good to have an idea of how all of that works. We know that there are differences between different types of parasites, of course. Cestodes, nematodes, nematodes. We'll talk about a few of the difference as we talk about the medications that affect them. So we'll start off our first category, which is macrolides. And these ones, typically we're talking about these drugs that end in -ectin. So examples, of course, are ivermectins. Dogs and cats, we use ivermectin and selamectin. And livestock, we use doramectin and ivermectin. Milbemycins as well belong to this category of macrolides. And of course, we have the regular one that's called milbemycin oxine, and then we also have Moxidectin. In general, these antinematodals have a wide spectrum of activity, but they don't get flukes and they don't get tapeworms. They have this macrocyclic ring in a chemical structure. They're a lipophilic drug with wide body distribution, and they're excreted as active drug in the feces. So we'll talk about that a little bit as we go through. So looking at the first chunk of them, the ivermectin, selamectin, doramectin, and ivermectin, of course, are the ivermectins. And then, sorry, that should say milbemycin oxime. That's one specific drug. And moxidectin are considered to be milbemycins. So looking at how macrolides work, at low doses, it stimulates the inhibitor neurotransmitter glutamate, and it allows for an influx of negative ions, which essentially is preventing depolarization. So looking at how it's working, it's affecting depolarization of the muscles in the pharynx of these little parasites. So what that means, of course, what is actually happening with depolarization, we have to get a positive charge on the inside and then it builds up and switches. In this case, it's allowing a ton of negative chloride ions in to the little muscle cells in the pharynx of these little parasites to prevent depolarization. So long story short, the little guys get paralyzed in their jaws. So they actually starve to death because the muscles of their jaws aren't able to depolarize. So they literally just starve to death. Main thing to note, other than of course how it works without going into too much detail, is that so we're focused on this glutamate receptor. If we go back, so it stimulates inhibitor neurotransmitter for glutamate. If we look at tapeworms and flukes, they don't have these glutamate receptors. So with that, they are immune to macrolides. Macrolides do not work on them. They have no mechanism of action. So there's no death with macrolides for flukes and for tapeworms. So that would be a good one to get to know why flukes and tapeworms are not affected by macrolides. So looking at macrolides, in general, these drugs are relatively safe. They're very common, well, fairly common, less common now because there's better drugs out there. But there is a potential for the drugs to combine with GABA, which can cause a sedating or CNS depressant effect in animals. So unlike connecting with the receptors for glutamate, the way they do in the parasite to cause that kind of essentially that paralysis type behavior in their mouse. In this case, we have an effect on our GABA receptors. Instead of glutamate, mammals, we have an effect on our GABA receptors. So, in general, we don't get this sort of stimulation or combination with GABA receptors because GABA receptors live behind the blood-brain barrier. So that's great. So we know that behind the blood-brain barrier, a lot of things will kick it out, won't allow drugs to accumulate back there. The main thing we rely on, because this is a lipophilic oral drug, and it could potentially jump this barrier and nicely diffuse across those lipid membranes, mammals rely on pea glycoprotein pumps to remove the drugs from reaching the brain. So let's just put this together a little bit. So in general, this drug has potential to affect our GABA receptors that are in the brain within the blood-brain barrier. However, in normal, healthy mammals, pea glycoprotein pumps keep this drug out of our blood-brain barrier. However, we have a picture of a collie here. What we know is that there are pea glycoprotein deficient animals. So animals with that MDR1 mutation, such as collie-like breeds, have the potential to get an accumulation of the drug behind the blood-brain barrier because the pea glycoprotein deficiency. So in this case, the drug is jumping the blood-brain barrier and it connects with those GABA receptors and prevents depolarization. So what can happen, unfortunately, is these guys can get a sedating effect from these kind of drugs. So in general, when we were talking about ivermectin and macrolides in general, the overall rule used to be white feet don't treat. So if it's ivermectin, if it's a macrolide, white feet don't treat, because if they have this MDR1 mutation, then again, the pea glycoprotein will not keep the drug out of their brain. And when it reaches their brain, there's potential it could cause a sedating effect. Signs of toxicity, so signs that this is happening, is of course CNS depression. And with that, we're seeing salivation and vomiting. Vomiting may also be seen just in the early course of toxicosis, so something for owners to watch out for. Sedation, weakness, and ataxia, pupil dilation, stupor, coma, and of course, death if it's prolonged or not treated. In general, some of these dogs, if they are seriously overdosed, then they actually may have to be monitored and maintained in a coma for weeks. So there's no surefire way to get this drug out of their system because it's highly lipophilic. We're not talking about, how sometimes we would just throw them on IV fluids and hope that we can kind of dilute it and flush it out of their system and out of their kidneys. In this case, it's very different because it's in the brain. So dogs that get overdosed by this often have to sit sort of in a stupor for weeks with nursing care working around them. Most often, this overdose is happening because dogs are getting into large animal products. So products that have a really high concentration of the drug and they're eating an abundance of them. So that being said, if you're a horse owner or a cow owner and you have a farm dog, be very careful with any of your macrolide treatments. Make sure that the dog cannot access them. So looking at our macrolides, we're talking about ones that are common to us, of course, are Ivomec, Iverhart Max, Heartgard, etc. Like we said, it's a broad spectrum antiparasitic except for flukes and tapeworms. Most often it's compounded, so most often, just like Heartgard over there on the right, it's ivermectin and Pyrantel, or ivermectin and another drug. Sometimes you can get ivermectin alone, especially if you're working with pocket pets who have mites and lice. Sometimes we'll use that. And in general, it's effective at really low doses. So if we look at this, of course, they have a white-footed collie. So white feet don't treat is our typical saying. But Heartgard was clever about it, and they put a collie on the cover of this product to remind buyers that they have formulated a dose that is safe and effective for collies. So with that, the important reason to note there, heartworm prevention, the amount of ivermectin that's needed for heartworm prevention is 0.006 milligrams per kilogram. That's why they can market it with a collie on the cover. The MDR1 deficiency toxic dose is 0.1 milligram per kilogram. So you can see that there's a significant difference between the level that's needed for heartworm prevention versus the level that becomes toxic for these guys. Normal dogs, the toxic dose is 2 milligrams per kilogram. So you can see how sensitive the dogs with the MDR1 mutation are to overdosing on macrolides. In general, if an animal has never had a macrolide before, and we have to think about this because it's heartworm season coming up and we're often dispensing this medication, we should let them know that it's ideal to watch them for about 8 hours after the first treatment. Like I said before, there's no true antidote for overdosing, and never give to lactating animals, so especially if it's for food production animals, because it will just end up through the milk. So there's no antidote for this. However, there is the potential treatment which isn't available in most locations in Ontario, but some referral clinics might have access to this. Intralipid therapy. So this is a puppy that overdosed on ivermectin. I think it was ivermectin. Either way, it was a macrolide. And you'll see the serious CNS depression that this puppy's undergoing. And what they had done is IV over a couple of days, they've administered this intralipid therapy. And there's a whole bunch of reasons that they think that it works. There's reasons about whether when you administer like a really lipid formula, does that drug bind to the lipids because it's super lipophilic? There's also talk about it really supporting the cardiac health of the animal because it just has so much lipid involved in it. Either way, they do find that in some cases an intralipid therapy could make a huge world of difference. So we'll just have a look at this video. Look at that sad puppy. Oh, his eye. So puppy's not doing so well. Yeah, fix that eye. So puppy's not doing so well, right? So then if we skip ahead a little bit, that'll do it. So the intralipid therapy is administered. Look at that. A day after the intralipid therapy. That's better. Way better. So it's kind of interesting because there's potential that the intralipid therapy could work, most definitely. It's just how available is it? And is that something that would be affordable for clinics, you know, other than referral clinics? Oopsies. But intralipid therapy, a potential treatment for overdosing. Okay, so looking at more specific drugs, so those ones we were talking about, ivermectin mostly. Now moving on to selamectin. Selamectin is the drug that is in Revolution. So it's a topical medication for fleas, ticks, mites, and feline hookworms and roundworms. It's broad spectrum for exo and endoparasites, and it's often used as a heartworm prevention. Looking at this, so selamectin, once it's applied topically, it's absorbed into the bloodstream. So that being said, dogs, about 4% is absorbed right into the bloodstream and is circulated around. Cats absorb about 74%. So their doses are the same. They work a little bit different. It's safe. It's extremely safe drug. I think they have it like up to at least 10 times the dose that the animal can get, and it's still safe for their organs. But what that means, because cats absorb so much more, if we go back, cats have a claim on label that Revolution will cover feline hookworms and roundworms. They don't have that claim for dogs. And the reason is dogs, only 4% absorbed, so it doesn't get as deep into the body in order to fight off those specific worms. Whereas cats, they get a whole lot more of the drug, so it's much more effective for internal parasites. So a common question that we get asked by clients, can my dog have a bath? Absolutely. I think on their website, Revolution says, as long as you wait 2 hours after application, then you're good to go for a bath and you're good to go for a swim. So that's something that's regular education that we have to talk to our clients about. How do I keep my dog out of the water? Well, you don't have to after 2 hours. Some side effects with Selamectin. In rare cases, they've seen alopecia, so hair loss at the application site. Sometimes fever or pruritus. MDR1 complications are extremely rare with Selamectin. Mostly we're seeing the MDR1 complications with Ivermectin. Seizures and death have been reported. Again, extremely rare. Super safe in pregnant and breeding animals. Safe in heartworm positive dogs and cats. And we'll talk about that later, why that's so important. Talk about that in a later PowerPoint. However, we do have to keep in mind it's not great for dogs under 6 weeks of age and cats under 8 weeks of age. So it's pretty amazing that all of these side effects are so rare. The other thing that clients really like about Revolution compared to some of the other topical medications is the lack of a smell. So it definitely has a smell, but it's not as strong as some of the other topical flea and tick medications. The other thing that's important to note about Revolution in general and Selamectin is it's very cost effective for shelters or for high volume, whether it's cat rescue, dog rescue, etc. So essentially, just one thing to keep in mind, you can buy one of the large boxes like a Revolution Plum for a giant dog. We know that doses are 6 milligrams per kilograms for dogs and cats. So essentially, just looking at this, each full dose of a Plum Revolution, so the one for extra large dogs, can treat 24 kittens or 8 cats. That's all. Nice and cost effective for shelters. Carrying on with macrolides, we have Ivermectin and Ivermectin. These ones are geared toward livestock. So Ivermectin or Dectomax is injectable and pour on for cattle and swine. Ivermectin is a topical in cattle, and both of them will capture nematodes, lice, grubs, and some forms of mange. They do have restricted use for lactating dairy cattle and for veal cattle of certain age. So again, looking at this, dogs, if you are keeping these products in your barn, make sure that they're up high, make sure that the lids are closed, make sure they're not easily accessible by dogs. Because these products are so concentrated, it doesn't take much for a dog to get a hold of them, have a small bite of them, have a good few mouthfuls, and then it can cause that awful CNS depression and of course death. So here's a little video, I love this video, of a pour it on solution. This is livestock, cattle, just getting their oopsies, antiparasitics poured on. Just a line down the back. It's good to know what we're talking about. So if I'm telling you all about like a pour on versus a topical, etc., it's good to have a quick idea of what it is I'm talking about when I say a pour on. And that's it. It's kind of like a gun that they use for cattle as they walk on by. All right, carrying down the line, macrolides. We have milbemycin, oxime, and in general, the milbemycin drugs. So within this class, we've got Interceptor, Sentinel, Trifexis, Milbemite, Milbemax, etc. So these ones are labeled for heartworm prevention, hookworms and roundworms, ear mites for the Milbemite odic, canine whipworms, and the side effects are rare vomiting and diarrhea and symptoms of toxicity which are similar to ivermectin in high doses. Carrying on is, actually I'll just go back to this for one more minute. So the most common one that you'll use in Ontario here is the Milbemite, right here, Milbemite, especially Milbemite odic is for these bad boys here. So beautiful little awful ear mites. Nice nails. So little ear mites, definitely Milbemite is a common treatment for ear mites. Milbemax is also could cover that as well, but Milbemax also has additional praziquantel. So Milbemax becomes a really well-rounded antiparasitic because it will also get tapeworms, which we'll talk about a little bit later in this lecture. Interceptor has sort of gone out of favor. We used to use Interceptor a fair bit for heartworm prevention, but it's less common because now there's just other drugs that are sort of an all-in-one. And you'll see that happen, and you'll have clients that call you and ask for sort of older products or products that are now out of favor. And it's fine. It's just that we recommend newer products quite often because they can just do more with less dosing. On with macrolides, we have Moxidectin, and the products we'll focus on are ProHeart 6, Cidectin, Quest, and Advantage Multi. Cidectin and Quest, we're looking at large animal medications. Cidectin mostly being geared toward cows, Quest toward horses. They are broad spectrum, ecto and endoparasiticides. They are helpful against, helpful. They're a good treatment against intestinal parasites, mites, grubs, horse stomach bots, delicious, lice, flies, and nematodes. So one thing to keep in mind, these ones are regularly used in large animal medicine. With the Quest, there's definitely an age restriction on usage in horses that are over 4 months old. So that's something to keep in mind. This was an example in your textbook. I think the horses were 2 weeks old that were given a high dose of Quest, and unfortunately they succumbed to some pretty severe CNS depression, central nervous system depression. So really important to keep that in mind over 4 months of age in horses. Also Moxidectin for equine use and cattle use as well is sometimes available over the counter. I'm not sure if it's over the counter in Ontario, but either way, you should be aware that clients may be using it on their own for their own animals. So of course, if they are using it and it's not something that was prescribed by your veterinarian, just keep in mind you may have to guide them through how to use it and why we're using it in animals over 4 months old. ProHeart 6 is a canine injectable form that's available in Canada. I think it's still available in Canada. It's just gone really out of style per se. It's a heartworm prevention, and it's a gastrointestinal antinematodal. So ProHeart is a 6-month injectable solution, which for pet owners is generally amazing. At the start of heartworm season, they give their pet this injection. Well, they go to the clinic, they get an injection, and then voila, they don't have to give their pet a topical solution once a month. They don't have to give them a tablet once a month. They're done. Really good in that way, especially for clients who struggle with compliance with medications. However, thing to keep in mind, there could be side effects, and once we've given that medication, we can't reverse it. So once it's in their body, it's in their body. Common side effects that do occur, although the side effects themselves are not common, but when they do, tends to be vomiting, lethargy, and then sometimes ataxia. Lastly, within this category of macrolides, looking at milbemycins, milbemycins, we're good. We have Advantage Multi. So Advantage Multi is a product that has imidacloprid as well as Moxidectin. So it's a combined product, and it's used for the prevention of heartworm disease as well as killing of the circulating microfilaria. So this is one, I think this is the only product on the market that has been trademarked and approved to safely kill the circulating microfilaria of a heartworm positive dog. So it's pretty cool. It also kills adult fleas. It aids in the control of sarcoptic mange, and it can aid in the treatment and control of intestinal roundworms. So this one's a pretty cool drug. It's very popular, but it definitely has that special label for killing off the circulating microfilaria in a safe way for dogs especially. So that's something to be aware of for sure. So looking at the product, when we break it down, the imidacloprid we'll talk about later when we discuss ectoparasites, but the imidacloprid is the flea component, and then the Moxidectin, of course, is responsible for the heartworm and endoparasites. Imidacloprid again for the adult fleas, and then to a point, or to a degree as well, the sarcoptic mange. Moving on to another class of drugs, the benzimidazoles, which is really fun to say. These ones typically end in azole. How do they work? Well, they compromise the parasitic cell wall integrity via beta-tubulin disruption. So essentially these drugs are attacking the beta-tubulin proteins in parasite cells, and beta-tubulin is necessary for cell division. So it doesn't affect adult mammalian cells, which is excellent. However, it could potentially affect rapidly dividing cells, so you have to be very careful with the animals who are pregnant. We generally would avoid these in animals who are pregnant. Normally, these drugs take 3 to 5 days of constant exposure to become toxic to the parasite cells. So these drugs are not typically a one treatment suits everybody. These ones typically are repeated. These ones are pretty nice in that they're inexpensive. Okay, inexpensive, widely available, clients like that, but they're not as great as insecticides, but they're a good option for their cost. So benzimidazoles, you will see them a lot in clinic, and they're a very common first defense against nematodes. Common ones that you will see: fenbendazole, also known as Panicure and Safeguard. We have broad spectrum antiparasiticide. They can help with hooks, with rounds, and with whipworms in dogs, horses, and livestock. So essentially we're looking at overall general nematode defense. They have limited cestode limited cestode activity, specifically for Tania pisiformis. They are off-label used for Giardia. So sometimes, if we go back to our metronidazole, which we've talked about ad nauseum, we know that metronidazole with prolonged use can have CNS side effects for a lot of patients. So if that's the case, the animal still has Giardia after 15 days of use, then they might switch to Panicure and see if it can help sort of kick that Giardia infection. Oxybenzodole is typically found in an equine paste formulation, so anthelicide EQ, and typically we receive it every 6 to 8 weeks as a deworming to avoid this chronic reinfestation. So if we're looking at animals that live in, a gated pasture, and especially a smaller pasture, smaller paddock, it is recommended that every 6 to 8 weeks they undergo deworming. Otherwise, they have the same foliage, the same animals are in and out of their paddock. There's a good chance that they'll just chronically become reinfested. Very common in large animals. Note, Fabental. So Fabental is another benzimidazole, is a prodrug. So this one, Fabental, is the drug that's found in Drontal Plus. Drontal Plus is another drug. I don't think I have a picture of it coming up, but Drontal Plus is another drug that you'll see at your regular animal practice, small animals, dogs and cats. And just a side note that Fabental is a prodrug to fenbendazole and oxybenzodole, and it's a drug that is always in a formulation in combination. So just brought that up. We will talk about Drontal Plus again eventually, but to note that the benzimidazole, which I can never say very well, that's in that drug is a prodrug for fenbendazole and oxybenzodole. So essentially when it goes into the body, it gets manipulated and biotransformed and is then the usable version, fenbendazole. That's all. That's all I want you to know about that. All right, carrying on with this class of drugs, benzimidazoles. Albendazole, also known as valbazen, is for livestock, for intestinal nematodes, lungworms, trematodes, cestodes, and protozoa. It does definitely have teratogenic properties, so we have to be super careful not to use it in pregnant animals, and it's generally not used too often anymore, just because there are better options available. No offense to valbazen, it's fine, it's a good product, but again, going back to those principles of antiparasitics selection, a lot of clients want something that is cost effective and really great with one dose, covers a ton of things with one dose. These ones were mostly focusing on roundworms with some increased action. And then thiabendazole is a broad spectrum large animal medication. Some resistance is occurring. It also has some antifungal and anti-inflammatory effects. So this one, thiabendazole, you might actually see more so in an otic preparation or topical solution for its antifungal and anti-inflammatory effects. Side effects of benzimidazoles could be vomiting and diarrhea, even at label doses, and excess salivation as well. Good effects, they're pretty broad spectrum, they're pretty inexpensive. Downside, we have to remember, typically we're talking about consecutive day dosing. And generally there are better products out there that are all-in-one treatments. But the biggest thing in clinics, I'll just zip back, it's really common to find Panicure granules and Safeguard in vet clinics that are being used for dogs and cats. Quite often off-label, but for dogs and cats. It's super cheap, and we know that it gets roundworms, and the number one most common parasite for puppies and kittens, of course, is roundworms. Moving on down the line to Pyrantel Pamoate. Mode of action causes spastic paralysis, which I love saying, causes spastic paralysis of parasite myocytes via nicotinic acetylcholine receptor activation. So essentially, acetylcholine, as we know, is a really important neurotransmitter in muscle contractions. And what happens, it results in the parasite muscle paralysis and death. So it's causing spastic paralysis, and eventually that becomes death. So it does not allow them to eat. And then, of course, once they can't eat, they're not doing anything. So important to note, so key points about Pyrantel is that it eliminates adult parasites only, and we need to repeat it in 7 to 10 days. So again, it's a nice drug. It can get nematodes, we're happy with that, but it's only going to get the adult nematodes. So if there's eggs, which of course there will be eggs, it's just like mice. If you see mice poo, there's a ton of mice in your house somewhere. If you see a worm, there's eggs, because that worm has undergone its life cycle. So that being said, it won't necessarily get the eggs. So hence why we have to repeat it in 7 to 10 days so that those eggs that have now sort of erupted into adult worms can be killed off. Side effects are rare with this one. Heavy respiration, sweating, and ataxia could potentially happen. So again, Pyrantel, another one you might see in your clinic for puppy and kitten type treatment. Main thing, it eliminates adult parasites only and needs to be repeated in 7 to 10 days. Strongid is the brand name that you'll often see. So it's really good, again, against ascarids, strongyles, pinworms, hookworms. Poor against cestodes. We typically do not use this as a go-to for any sort of tapeworm activity. Likewise with whipworm, doesn't work well against whipworms. And we're using it for dogs, cats, horses, and livestock. So again, dogs and cats, we're typically using it off-label, just to be very aware of that. Shake it very well, because it It's granular, so it's kind of like chalk mixed with water. And if you don't shake it very well, then you're just going to get a lot of the suspension agent, and you could actually underdose your patients. So you could underdose the patient that you're seeing this time, and eventually, if you leave too much of the material of the drug itself in the bottle, then of course you're going to overdose your next patients. And then why should we run a fecal first? So we've got a puppy and a kitten. They've come in for their first exam. Clients always want the dewormer, and they want to know, why do we recommend running a fecal flotation? And if you were here in front of me, I would ask you this question and you could answer it, but you're not here. So why do we want to run a fecal? The reason for this, we don't know what parasites that puppy and kitten have. And in order for us to do our job properly, we know that this drug only works against certain parasites. So it has really crappy tapeworm coverage, really crappy whipworm activity as well. So if that puppy or kitten has tapeworms, or if they have whipworm and we're just giving them Strongid, it's not going to work very well. So now we've wasted the client's money. We've given them a dewormer. It's only working for the roundworms that that puppy or kitten had, and they still have whipworm or tapeworm. So this is why we should run a fecal. We should know what we're working with, know what we're up against, so that the doctor can prescribe the right medication. It goes back to similar components as running a culture and sensitivity before prescribing an antibiotic. It's good to know exactly what we're working with to choose the right drug that will work against that specific parasite. Looking at Pyrantel as well, like most drugs, it's often combined with other medications to increase its spectrum of activity. So if we go back to HeartGuard, we talked about HeartGuard in regard to its ivermectin ingredient, its ivermectin drug, but it's also crossed with Pyrantel. Gives it a broader spectrum of activity. Likewise with Drontal, not Drontal Plus, but Drontal, we have praziquantel, which we'll talk about in regard to cestodes, and also Pyrantel. So you start to see this a lot. This is a theme where drugs get mixed together to help improve their spectrum of activity. Again, we're looking for that one size fits all. That one size will kill everything, parasite-wise. Realistically, it's not realistic, but we try. All right, carrying on. So another type of antiparasitic drug, another antinematodal. We have imodepside. The drug brand name that we're most often talking about here is the one called Profender, and it's a topical treatment. So Profender is imodepside mixed with praziquantel. So praziquantel, we've talked about a little bit, covers tapeworms, and imodepside is going to cover hookworms and roundworms. However, when we mix in that praziquantel, it's also going to cover tapeworms. The mode of action, it causes flaccid paralysis through the release of inhibitory neurotransmitters. So essentially, the worms become flaccid and they're not able to move, they're not able to eat. So this is a really cool drug. I'll just talk about its side effects first. So potential teratogen. So of course, that being said, there's potential that it could disrupt fetuses. If you're using it because it's topical, remember, anything that's topical for an animal has the potential to be absorbed through our skin as well. So if you're using it and you're pregnant, you should probably wear gloves. Yes, it's very unlikely that the dose that you're administering to your cat would cause teratogenic effects on your baby or fetus. However, it's good to wear gloves just in case. In rare cases, they can get dermal or gastrointestinal side effects, but it tends to be short-lived. So, good thing about this drug, it is a spot-on treatment that gets tapeworms. So thinking about the animals that we might want to use a topical treatment for, who don't we want to pill? We don't want to pill grumpy cats. We don't want to pill cats in general, but grumpy cats for sure. So if you have an outdoor cat that's one of those sort of untouchable cats who's a high predator, high-ranking predator, or has a high likelihood of acquiring tapeworms by eating all of these things like rabbits and mice, that is the cat that Profender was created for. So it's pretty amazing if you're managing like a feral cat colony and you want to get the roundworms and the tapeworms under control, then you can definitely use Profender, this topical treatment, to work with those cats. I would not want to pill this cat. I mean, you can, but I'd much rather just put a little drop on its back. So this one, another class of drugs, it's an antinematodal. It's called Piperazines. And right away, you can just put a little X beside this one because we don't recommend Piperazines, and I'll tell you why. So Piperazines have a narrow spectrum against ascarids, only effective really against roundworms. They're ineffective against many parasites, especially hookworms. So they're really ineffective against hookworms. The way they work, they paralyze the adult parasites at the neuromuscular junction, and they're considered a vermifuge. So the worms are expelled paralyzed. So it doesn't actually kill them. It's not a vermicidal. So this, again, these are reasons why we don't recommend it. So it's a narrow spectrum. It only is effective against roundworms. And it is paralyzing the worm. It's not necessarily killing the worm. So what ends up happening are these worms are expelled through the gastrointestinal tract, sometimes still alive and twitching. So unfortunately, what could happen is because they're just paralyzed, if they're paralyzed and they stay in the gut, then there's potential that this product will wear off. The worms themselves will live and they'll be able to reinfect their host, which is unfortunate. Or they'll live in the environment for a little bit. The dog will eat them because we all know that there's dogs that eat poop out there, and they'll get themselves reinfected. One thing that's important to us, or important for us to know, of course, is that this could be found over the counter, at least in the States for sure. I don't know how widely available it would be in Canada, but of course, if clients are using it and they say, oh, no, he was already dewormed, we're good. The conversation that we need to have, again, goes back to running a fecal, seeing if this drug is even effective for the parasites that their dog or cat has, and then, of course, talking about a drug that would be a little bit more effective for a broader range of parasites. So we don't generally recommend Piperazines. It's my kitty cat sneezing in the background, if you can hear that. He's got his own little coronavirus. Not funny. It's true, but not funny. Levimazole. I can never say this one. There's a whole bunch of them that I just get confused with my pronunciation. So this one has a narrow spectrum. It has a lower margin of safety. We don't need to talk about this drug necessarily. It's not being used. It's not recommended. It's one that's brought up in the textbook just to note as a public service announcement. It's a drug that was originally used as an antiparasitic, but it's, again, super narrow spectrum. And what they found with prolonged use or high dose use, it can actually cause necrotizing lesions in the vasculature and inflammatory lesions throughout the brain. So in the textbook, it talks a lot about this used to be a drug that was widely prescribed, widely available, and unfortunately, the only thing you'll find it used for now, sadly, is an additive to cocaine that drug dealers use to increase the amount of money that they can get for a small amount of cocaine. But something to keep in mind, this is my PSA. Reminder, it can cause necrotizing lesions in the vasculature and inflammatory lesions in the brain. So it's a drug that used to be widely available, used to be used, no longer used so much, but it's used for darker purposes. Okay, and then we'll end today with anticestodals. We'll talk about praziquantel and epsipantel. Looking at a review of tapeworms, we have Diploidium caninum from fleas, and we have Taenia taeniformis, which is from the predation of rabbits and rodents. So again, clients will often say, there's no way my cat cannot have tapeworms. Absolutely not. It's an indoor cat. There's no way. We know in reality, a lot of our houses have mice, whether we want to admit it or not. I understand that. Cats eat mice. That's life. That's how indoor, never been out cats get tapeworm. This is an education point for the RVT. So looking at tapeworm, of course, remember it needs to travel with an intermediate host, whether that is a rodent or that might be a flea. And then, of course, it makes its way into the animal, either through the flea or through ingestion of the rodent. And then, of course, develops into a disgusting tapeworm that takes up space in their gut and then continues to shed into the environment. So looking at anticestodals, in general mode of action, they kill the entire parasite, not just the segments, or they have to kill the entire parasite, not just the segments, so that there's no regeneration from the scolex. So the head, of course, if it's just the segments that are wrecked, then the head can regenerate segments. Paralyzing the tapeworms through diminished intracellular calcium is generally how they work. So loss of intracellular calcium causes paralysis. We know that calcium is needed within that exchange for muscle contraction. And without this, then of course it's going to compromise the parasite external cuticle as well, which causes leakage of essential nutrients. Isn't that disgusting? And it unveils antigens so that the host can kill the parasite. So essentially what it's doing is causing a leaky tapeworm so then the body can recognize, so the mammalian body can recognize the tapeworm, create antibodies to it so that the immune system and the host can kill it off entirely. Dead parasites are digested, so this means that they don't shed the proglatids. So we're not going to see the tapeworms coming out. So clients might be waiting, because clients do cute things. Clients might be waiting like, oh, I haven't seen him pass the tapeworm yet. I haven't seen him pass it. No, they just digest it. They use every little bit of that tapeworm. It differs from antinematodals with anticestodal activities, which in some cases you'll see the full parasite or pieces of the parasite being shed in the feces. Okay, praziquantel, start her off. Droncit and Drontal, so this is the main drug in Droncit, which is the injectable version, and Drontal, which is oral, but it also has Pyrantel, so Drontal oral is a combination drug. Has a really broad spectrum of activity provided by a single dose, which is really nice. For cats, it will cover Taenia and Diploidium, and dogs, it will cover Taenia, Diploidium, and Echinococcus. And especially, super important, it will cover Echinococcus granulosus, and I'll come back to that in a second. It's not ovicidal, so just to keep in mind, this is affecting the adults only. And there are in tablet and injectable forms. So we've got Drontal, which is the tablet, and Droncit, which is the injectable. They do have high rates of efficacy with a single use. However, just in case, because it's not killing off the eggs, then definitely a fecal should be checked in a few weeks. So key piece here, if we look at Echinococcus granulosus, that creates that hydatid cyst disease. So that is one that is a zoonotic risk that is becoming very, very much on our radar in Ontario, because we're starting to see it in wild animals and even dogs up north, and humans can get it. So Bayer was really, really, really happy because they have a fantastic claim against this Echinococcus species with these drugs. So Bayer was pretty happy to announce that to all their vet clinics that, hey, you're worried about Echinococcus granulosus? Well, guess what? We got a product for that. Adverse effects with praziquantel are rare. Vomiting, definitely pain at injection site might be a little bit more common with the Droncit. And then sometimes in rare cases they can get post-injection ataxia and drowsiness. So again, just letting clients know what to watch for. These products generally are expensive. Droncit and Drontal are expensive. A lot of clinics I've found are no longer carrying them because of the expense compared to the amount of tapeworms that they're seeing. So in southern Ontario, we don't necessarily get as many tapeworms as they might in northern Ontario. So again, it's up to the clinic whether or not they want to carry it. Just a reminder, if we're talking about removing Diploidium caninum, we have to remember that we have to treat for fleas. Fleas are what's transferring that tapeworm to the animal. The animal almost guaranteedly is almost guaranteed to have fleas. In the case of cats, they may have come in contact with them. Dogs, there are fleas. So clients don't like to admit that, or it's harder for them to acknowledge that, but we also need a flea treatment as well. Epsiprantel, known as Cestodes, it has a narrower spectrum of activity than praziquantel. Taenia and Diploidium, definitely, it will cover no problem. The key point here is it's ineffective against Echinococcus species. So again, going back to the fact that Echinococcus is zoonotic, Echinococcus granulosus, of course, is zoonotic, and it's currently a huge problem, or starting to become a huge problem in Northern Ontario. Cestodes would not be the best choice for animals that are at high risk of Echinococcus. That's the take home for you guys. It has low systemic absorption through oral dosing, so it has less risk of systemic side effects, and it dissolves the tapeworm, like I said before, no segments in the stool. There's no injectable there's no injectable, it's single dose, and not for use in puppies or kittens less than 6 weeks. So the key fact here is Cestodes or Epsiprantel is not the ideal choice if we're suspicious of Echinococcus. And this, look at this beauty. So this is a perioperative photograph of right hepatectomy, so liver removal, of a patient with Echinococcus infection in the Netherlands. So a lot of these Echinococcus species create, and this is a human, which is upsetting, but a lot of these Echinococcus species create this hydatid cyst disease where they create these huge, disgusting cysts in the liver. And common for it to happen in mice and rodents that are out in the wild. Then of course the carnivore eats those intermediate hosts, and now there is potential that humans can get it as well. So again, Cestodes, not the best choice if Echinococcus is suspected. And that is all.